Hi everyone, how you guys doing today? Um, Today I'm gonna be talking about the hepatic portal vein tributaries. This is gonna be the first lecture I'm gonna be going over before I move into the pathophysiology of why we are going over this. I think every student should understand the anatomy at least before they can actually progress to learn the pathophysiology of disease processes, because it allows you to basically appreciate the disease process and be able to actually understand why patients present with the symptoms. So let's begin. So I'm gonna basically point out the most important structures. This looks like a busy slide, but overall, I think you just have to know actually very few things, and once I go through, you get the hang of it by the end of this lecture. So the first thing I want you to notice is the liver, and you can see the liver has like the right lobe and the left lobe right here. The green is the gallbladder, and I want us to kind of go over the tributaries that leads to the liver uh, by starting from right around the stomach. So usually when you eat food basically go through your esophagus, down, all the way into your stomach, goes into your duodenum, all the way down to your jejunum and terminal ileum, which will be right there, where all your digestion is mostly happening, and all the way into the ascending colon, transverse colon, all the way down to your descending colon, and down into your rectum and your anus. So that's kind of like how food normally pass through your body. But the most important thing about this slide I want you to kind of focus on is actually this little tree looking like kind of bluish purple venous system. First, I want you to notice that most of the digested products, food substances, actually been dumped back from the descending colon, the sigmoid, and they're basically going all the way through your inferior mesenteric vein. That's all you need to know. This extra stuff, maybe for your anatomy class, sigmoid rectal veins, but for the purpose of this lecture and the clinical application, which we will talk about in the next lecture, you can see here I highlighted in yellow the inferior mesenteric vein. Also, I want you to notice that if you trace that as it's going all the way, it forms a confluence with this vein also draining from your spleen, so that's your splenic vein. And I just want you to take note of that your splenic vein and your inferior mesenteric vein joins together actually to form the splenic vein, and you can see it right there. So that's an important thing to know. This will also join with this big vein, which is basically a tributary of different anastomosis, but the most important thing you have to know is the superior mesenteric vein. And the superior mesenteric vein and the inferior mesenteric vein, which is actually joining with the splenic vein, as you can see, it drains actually into the splenic vein. Both of them form together to form this hepatic portal vein. That's the most important vein. I think every student need to know that, because when we talk about portal hypertension, this is what we are referring to right here. But I'm not going to go into great details. We're going to talk about it in the next lecture. So this is the hepatic portal vein. The hepatic portal vein is not going to drain into the liver. And as you can see, it splits up. Now, another important thing I want you to understand is that you can see the middle rectal vein and the inferior rectal veins right here. And they have clinical and significance, and we'll talk about them, but make sure you understand that as you can see, this inferior rectal veins, they also drain all the way into your inferior mesenteric vein eventually. So when you get portal hypertension, you probably be able to see kind of hemorrhoids forming down here, and I'll go over that also in a minute. Another key important thing you need to understand is, as you can see, this is your stomach. This is it has a fundus and has the greater curvature, kind of the lesser curvature right here. I kind of want to drag your attention right here to see that there's this esophageal veins They're actually wrapping around your esophagus, and they also drain into your left gastric vein, which basically form this kind of wire loop and drains also into your portal vein. Also, another branch that's coming to drain into your portal system are these paraumbilical veins, and you can see how they both drain into your portal vein, and eventually stuff that goes into your portal system eventually drains into your central vein, which eventually exit out through the liver through the hepatic vein, which is actually not shown on this picture, and that will be drained into your inferior vena cava. So in general, that's the anatomic relationships I think you should understand, because when I talk about portal hypertension in the next video, and I'm just going to touch a little bit about it right now, but you'll be able to see me in the next lecture, and we'll go into details of the clinical applications you need to watch out for, the signs and symptoms patients are going to present with, and also the treatment options. But overall, when you get a portal hypertension, you get a backup, right? So imagine if I block flow into the liver, blood start to back up into here, and you see these paraumbilical veins, and they appear on the patient's belly as caput medusa. Also, if they back up all the way into your gastric veins and eventually backs up all the way into esophageal veins, if you do an endoscopy, you'll be able to see the patient has esophageal varices, which are these tortuous dilated veins in the patient. Another important thing you'll see is splenomegaly, right? The spleen is not able to basically drain all its byproducts, which are breakdown of red blood cells, bilirubin, and that kind of stuff. It backs up and the spleen becomes really enlarged. Also, you'll be able to notice that the patient probably will be complaining of hemorrhoids, which would be these enlarged tortuous veins, and they'll be telling you, "Oh, doc, you know, when I poop, I kind of feel like something is bulging in my butt." And that's basically because the inferior rectal veins are all distended, and it's kind of like pushing into the canal. So those are the basic clinical relationships I want you to know for this for now. We'll go into further details, actually the signs and the symptoms. This is just anatomy, just for you to be able to kind of see how things are related. And I think if you just know this, everything else would make a lot more sense when I go into details about what you actually see on the patient, how they present with, and the pathophysiology and the clinical applications. I hope you enjoyed this lecture. Please subscribe to my videos, and I'll be coming up with more videos as time goes on. Thank you for your time. Take care.
Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX, or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, you're able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level with your medical knowledge. Let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.